My name is Mark Ryberg, and I'm Managing Director and Head of the Physician and APP Workforce Practice at SullivanCotter. And I've been here at SullivanCotter for 10 years, working in all facets of physician compensation, including fair market value work, the evaluation of highly compensated providers, including luminaries, as well as provider compensation design. It's a great question relative to how does one appropriately assess the market need for providers in a given geography. And it is not an easy answer. The reality is it's a multivariable assessment. One, you need to understand what the demand in your local market is. In today's environment, we don't have the margins or the return to be able to just hire physicians at will. We've got to understand where market demand is moving, and that market demand might be moving. It might be moving generationally, it might be moving on a specialty by specialty basis, but we need to understand almost at the local and regional level where we expect to see demand, both in the short and the long term in terms of the types of patients. And once we understand where that demand exists, then we can understand how that compares to the relative supply of providers we have in-house today. And we can also understand how it compares to the relative supply of providers in the broader markets that we serve. And when we compare an analysis of both, we're able to understand whether we're short, whether we're on par with the demand, or whether we're overstaffed in a particular area. And this has benefits for us as an organization. One, it allows us to ensure that we've got the appropriate number and type of providers to meet our patients where they are today, but also allows us to start preparing to meet our patients for where we expect them to be tomorrow. Additionally, it helps organizations ensure they're not overprescribed in a particular area, meaning they don't have a bolus of providers that exceed the local market demand and we become economically inefficient. So it's really an advanced calculus that allows our organizations to ensure they're approaching their staffing to meet the market need where it is in the most economically efficient means possible.